Welcome to the Deep Dive. Today we're getting into something that affects, well, pretty much all of us. The lipid panel. You know, your cholesterol test, total cholesterol, HDL, triglycerides, and of course the notorious LDL-C.
And we're talking about how the fundamental rules for getting that test have been completely turned on their head recently.
Right. For as long as I can remember, the rule was you had to fast, no food for, 9 to 12 hours?
At least. It was considered the absolute gold standard. The thinking was it would minimize variability and make sure the calculations were valid.
But it was such a pain. I mean, it must have been a huge barrier for people actually getting tested.
A massive barrier. Compliance was a huge problem, and that's why the paradigm has shifted. All the big international guidelines now, like from the ACAA, they say for most routine screening, you don't need to fast.
Okay, let's unpack that, because it seems counterintuitive. If you eat a meal, especially a fatty one, and then get your blood drawn, your chemistry has to change. How can that test still be reliable?
That's the key question, and the answer is that it's a differential impact. Not everything changes.
Yeah.
Your total cholesterol and your HDL-C, the so-called good cholesterol, are remarkably stable. They typically change by less than 5%.
So they barely move.
Exactly. The component that goes haywire is your triglycerides, or TG. They can spike significantly after you eat. We call it postprandial lipemia.
So that TG number is just junk data then?
Well, not necessarily, and this is the interesting twist. That spike is now seen by many as a sort of real-world metabolic stress test.
The stress test.
Yeah, it shows how efficiently your body clears fats from the blood. And that post-meal TG level might actually be just as predictive, or maybe even more predictive, of future heart problems.
That makes sense for TGs, but if they're the only big variable, why did the whole test require fasting? Was it something, I don't know, deeper in the lab process?
It was analytical. The whole reason for fasting was tied directly to how we calculated LDL-C.
The Friedwald equation.
That's the one. It was basically a cheap calculator that broke if the inputs changed. It relies on a very simple fixed assumption.
Which is that your VLDL-C is just your triglycerides divided by 5.
Right. And as soon as you eat and your TGs go up, that simple math is violated. It completely breaks the calculation.
And it breaks in a bad way, right? It doesn't just give a random number.
It breaks in a very specific and kind of dangerous way. It artificially drives your calculated LDL-C down. For some high-risk patients, it could drop by almost 20 mgdl.
Wait, so the old method was only about 59% accurate if you didn't fast? That's barely better than a coin toss.
It was terrible, which is why the modern fix is twofold. First, we use a much more reliable metric, non-HDL-C.
Which is just total cholesterol minus HDL-C.
Exactly. Since both of those are stable, the number is solid, fasting or not. And second, labs just have to ditch Friedwald and use better math, like the Martin Hopkins method. That gets the accuracy up closer to 74%.
So bringing this all back to the listener, what does this mean for you? When do you actually still need to fast?
We run on what's called a conditional fasting model now. Fasting is only for very specific, high-precision scenarios.
Okay, like what?
One is when you're first starting a statin. The doctor needs a really accurate baseline LDL-C. Another is if your first non-fasting TG test comes back critically high, say, between 10 and 20 mmol.
Which is pretty high, over 880 milligdl for those of us in the States.
Very high. You'd need a fasting test to confirm what's going on. And anything over 20 is an immediate specialist referral because the pancreatitis risk is so high.
Got it. And there's a safety angle here too, right?
A huge one. For patients with diabetes, we now strongly prefer non-fasting tests to minimize any risk of hypoglycemia.
And what about alcohol? That rule still stands, right?
Oh, absolutely. That one is non-negotiable. Regardless of food, you must strictly avoid alcohol for at least 24 hours before the test. It's a potent factor for spiking triglycerides.
So the conditional model really is the best of both worlds.
It is. It maximizes compliance while maintaining accuracy because we're just using smarter methods in the lab.
And it seems like the future is moving even further away from fasting. The next step seems to be these fasting-independent metrics, like apolipoprotein B, which, tracks the actual number of harmful particles in your blood, not just the cholesterol mass inside them.
It's a much more direct measure of risk.
So here's a final thought for you to chew on. As labs continue to adopt tools like ApoB, this whole conversation about fasting for cholesterol test might just become a footnote in medical history.